When you think of utilities, what comes to mind? Running water from a main line, electricity from a plant or panel, heat from gas or power, and connection. The pandemic revealed the pain of not being connected to the internet. From when we learn, work, talk to a doctor, see loved ones, or even use government services.
The true measure of the digital divide is often a subject of debate, and that really gets to the heart of how we apply the certain measures and criteria. Generally speaking, people will come around the number of about 42 million Americans today are impacted by the digital divide. Now that's further nuanced to say about 43% of low-income communities are disproportionately affected, and then another 15% of rural communities will begin to define that.
The main issue with the lack of internet connection is that we have a segment of our populations that are not able to access economic opportunities. They're not able to access educational opportunities. They can't collaborate or actually gain access to all the free resources that are widely available on the internet. And so this issue, a gap that we call the digital divide, those that have access to internet and those that do not. It includes minority populations, specifically low-income households, Black, Hispanic, and Native American households that are disproportionately represented in the digital divide. It also includes those that live in rural areas. Those are communities that actually don't have access to infrastructure.
So here at University of Louisville, we see Medicare and Medicaid patients, and telemedicine has been a great resource for them because now we can see our patients either through audiovisual or telephone, and these patients can be a little more medically fragile. Sometimes these patients have more chronic disease, they're more severely ill or have a higher acuity. They may have transportation problems, education, understanding, or compliance issues. And so having that resource with their own primary care provider helps them build trust and education and hopefully keep them out of the emergency room or urgent care centers.
The effects from a lack of digital access can be far-reaching, but during the COVID-19 pandemic, the digital divide widened. While those connected to broadband could convert to telework, health, and schooling with ease, those unconnected struggled to not only gain access to what they had before, but stay connected to needed resources during uncertain times.
Digital inclusion refers to activities that are necessary to ensure that all individuals and communities have access to internet and are using it meaningfully. The first part of it is that, do people have access to high-speed internet? And is it affordable for vulnerable populations? The second part of it is, do they have access to internet-enabled devices? And those internet-enabled devices should be devices that meet their needs. For example, a smartphone, as great as it is, not great for a high schooler trying to write a paper. So when we talk about having an internet-enabled devices that meets the student or the individual's needs, we're being very specific. And so the third element of internet is that people have access to training. And the way that works is that they have to have access to applications and tools. And it also entails the programs that communities need funding for in order to make sure that all those elements are addressed.
What's really important is we have to understand the digital divide is also made up of very unique circumstances that impact each community and demographic. For instance, tribal communities and veteran communities wrestle with their own unique characteristics as they define the digital divide. As a country, we can only move to the pace of our slowest participant. We know that those students that went home to disconnected homes or in homes where there was a lack of a device, they suffered disproportionately a learning loss that will not only impact that generation, but for the society that is going to accept those individuals into it. We have to make sure that the digital divide is not an impediment to our progress as a country.
Telehealth, telework, and remote learning should not be exclusive to a zip code. That's why Connected Nation works with local, state, and federal leaders to create long-lasting and impactful change.
Someone once said that talent is distributed equally, but opportunity is not. We want to make sure that irrespective of where you live or what circumstance is inside your home, that if you're the next great scientist or the next great artist, that you have the opportunity to pursue those dreams and make an impact on society.
So the benefits of telemedicine, we have found that there is a very high patient satisfaction rate and also a very low no-show rate. Patients will keep those appointments. We're also happier because it's less time away from school or family or work and less exposure for everybody in the office. So overall, I would say that telemedicine is not going away anytime soon.
Thanks to an unprecedented level of funding for broadband, there's now momentum to finally close the digital divide. As our country does so, we need to ensure internet access remains inclusive, especially as new technologies emerge and infrastructure groundwork is laid for generations to come.
The digital divide is not only an issue of have or have-nots, it's the issue of connectivity, it's the issue of people having devices that meet their needs. And so as a result of that, we advocate for the communities to actually collect data. And we also advocate for them to have technology action plans that are very clear on the definition of their problem and the recommended solutions that will help that community overcome those challenges.
Well, I think what we have to consider is the internet that we enjoy today is really a product of something of the last 30 to 40 years. When we think about the smartphone, for example, that everyone now carries in their pockets, that's really an invention that has been seen just in the last 15 years or so. So when we think about what a digital accepted community could look like in 10 years from now, it's hard to even tell what they could look like. So we have to have the long game in mind and know that we have to provide the future proofing for those communities. Making sure that the infrastructure is there, making sure that the skills are there amongst the people that live and work in those communities, such that whatever technology brings, that they're ready for it and can take full advantage of it. We believe that everyone belongs in a connected nation.
To learn more, contact us today.